Right now, over 8 million Americans are living with diabetes and have no idea. Their bodies are sending out distress signals, but the damage is happening internally. Over months and years, excess sugar in the bloodstream degrades the vascular system, turning brittle what should be flexible and strong. High blood sugar acts silently, attacking the protective layers of your nerves, stiffening your blood vessels, and placing a massive filtering burden on your kidneys. Because the process is slow, the damage often accumulates long before a doctor orders a standard blood test. But your body does have an early warning system. The earliest visible signs of this damage appear at the furthest point from your heart, your feet. Millions of people notice these physical changes every day and dangerously explain them away. They assume these symptoms are simply the result of getting older, wearing tight shoes, or dealing with dry winter weather. In the next 5 minutes, we will develop a 3-part daily routine to identify 9 specific warning signs and actively protect your circulation. Recognizing these indicators shifts the focus from waiting for a lab result to observing the daily health of your own circulatory system. Step 1 begins before you get out of bed. Every morning, perform a 5-minute routine of ankle circles and calf stretches. Flex your feet and get your joints moving before you put any weight on them. While you are stretching, look closely at your lower legs and toes for sign number 9, an unexplained loss of hair in these areas. Hair follicles require a steady supply of blood and oxygen. When high blood sugar damages your blood vessels, those internal irrigation pipes are blocked. The follicles are cut off and the hair stops growing. Next, evaluate the temperature of your skin to check for sign number 8. Persistently cold feet. It is a major warning if your feet consistently feel freezing during July or remain cold under thick blankets. Finally, look for sign number 4, abnormal skin discoloration. Specifically, search for patches of dark, deep red or bluish skin pooling around your ankles. That discoloration is a direct visual signal that your lower extremities are starving for oxygenated blood. This 5-minute morning routine is a mechanical intervention, forcing oxygen-rich blood down the longest delivery route in your body to start the day. Step 2 focuses on your daytime defense, requiring 3 non-negotiable habits: drinking 8 glasses of water, adding fiber to your meals, and taking a 20-minute purposeful walk. These 3 actions help manage glucose levels and defend against sign number 1, frequent tingling or irregular pins and needles sensation in your feet. Peripheral neuropathy acts like this electrical wire. Elevated blood sugar acts like an acid, slowly eating through that plastic coating. The signals misfire and become fuzzy. That fuzziness is the tingling you feel. Excess glucose also places an enormous burden on your kidneys, which brings us to sign number 6, persistent ankle swelling, known as pitting edema. You can easily perform the pitting edema test by pressing your finger firmly into the swollen area of your ankle. If you remove your finger and the indentation remains for several seconds, the fluid is trapped. When blood sugar damages the filters in your kidneys, gravity pulls that excess fluid down to your ankles, and high dietary sodium causes the body to retain it. Daytime hydration and movement are the mechanical requirements to flush out nerve-destroying sugars and keep your body's filtration system moving. Step 3 is your nightly inspection. Every single evening, sit down in a well-lit space and physically audit your feet. Look at the heels, the soles, and the spaces between every single toe. You are checking for sign number 3, non-healing wounds. A standard blister from a shoe should close and heal within a week. A diabetic wound will remain open and vulnerable. High blood sugar stiffens the tiny blood vessels in your feet, cutting off the oxygen and white blood cells your body needs to repair open tissue. Follow the 48-hour rule. If you find any cut that hasn't improved in 2 days, make sure to call your doctor immediately. Next, check your heels for sign number 5, chronic, severe cracked heels that persist regardless of the season or how much lotion you apply. These deep skin cracks occur when damage to the autonomic nerves causes your sweat glands to stop producing natural moisture. This nightly visual audit catches these small structural failures while they are still treatable, preventing the serious infections that can lead to amputation. Step 4 is topical care. Apply pure coconut oil or a high-quality moisturizer strictly to the soles and heels of your feet to create a moisture barrier. Be careful to avoid the lotion trap. Never apply moisturizer between your toes, as that trapped moisture creates a breeding ground for fungal infections. Finish your routine with a gentle 3-knot massage, using light, circular strokes along the sole and up the ankle to stimulate blood flow. Once you are resting in bed, pay attention to sign number 2, a distinct burning sensation in the soles of your feet. This burning is caused by a damaged nerve acting like a faulty fire alarm. The building isn't on fire, but the sensor is sending panic signals to your brain anyway. Also be alert for sign number 7, sudden stabbing or electric shock pain occurring at night. Avoid taking ibuprofen to numb this pain, under the assumption it is just arthritis. Numbing the pain hides the signal your body is sending, while the underlying nerve damage continues. External foot care is ineffective if you ignore the internal alarms your damaged nerves are sounding. You now have a complete daily process to monitor your vascular health and identify the hidden markers of high blood sugar. The 9 warning signs are persistent tingling, burning soles, non-healing wounds, skin discoloration, chronic cracked heels, swollen ankles, electric shock pain, persistently cold feet, and unexplained hair loss. If you noticed even one of these signs today, do not wait for it to resolve on its own. Schedule a fasting blood glucose test this week. It takes only a few minutes, costs about $12, and is covered by Medicare for most patients. Proactive daily monitoring is the only way to catch these issues early and preserve